Hey guys, this video is continuation of surface anatomy part 1. Um, Firstly, the surface landmark here is semilunar line. This semilunar line is located lateral to the rectus abdominis muscle, and it extends from the tip of ninth costal cartilage to pubic tubercle. In this picture you can see the highlighted one is the semilunar lunar line, which is lateral to the rectus abdominis. This one is the rectus abdominis muscle. It is lateral to the rectus abdominis muscle, and there is one clinical point here. If there is any weakness, if there is a weakness at pubic tubercle, leads to development of a hernia known as Spigelian hernia. Our next surface anatomy landmark is navel. We know this already, which is also known as belly button. This one right here. Next one is anterior superior iliac spine, axis. To palpate this, put your hands on your hip and move. You can palpate this surface anatomy landmark. You can see the location of axis here. Like this, if you put your hands on your rib and you move, then you can palpate this surface anatomy landmark. Next one is inguinal ligament. It extends from axis to pubic tubercle. This one is the inguinal ligament. Simply it is like a line passing from axis to pubic tubercle. This one is the axis, we know this already, and this one is the pubic tubercle. So the line that passes, or the ligament that extends from axis to pubic tubercle, is inguinal ligament. Now for the genitalia, we will divide like female genitalia and male genitalia. Firstly, for the female genitalia, mons pubis, it is only present in females. This mons pubis is situated over pubic symphysis of pelvis. It is a part of female external genitalia, which known as vulva. This vulva includes all external parts of female genitalia like clitoris, labia majora, and minora. For the male external genitalia, firstly penis, external organ of the male reproductive system, and urinary tract as well. That's the penis. Next anatomical feature is glans penis. Distal to the distal end of the penis is the glans penis, and it is covered by double layered skin, which is called or known as prepuce or foreskin of the penis. Okay. Now next anatomical landmark is scrotum. This one is the glans penis. Next one is scrotum. It is a sac that composed of superficial fascia of abdominal wall internally and skin externally. This scrotum houses or the contents of the scrotum are testes, epididymis, dorsal portion of spermatic cord. This one is the scrotum. You can say that it is a sac that is composed of superficial fascia of abdominal wall internally and skin externally. This one is the scrotum. It is the continuation from the abdominal wall, right? So this scrotum is composed of superficial fascia of the abdominal wall internally and externally by the skin. Now we will look at the posterior surface of the axial body. Firstly, external occipital protuberance, which is a bony protrusion. It is present at the posterior aspect of the base of the head. This one is the external occipital protuberance. We know that this is the occipital bone, and this one you see right here, it's like a bump, or it is like a protrusion, like bony protrusion, that is located in the posterior aspect of the head, which is called external occipital protuberance. Next landmark is vertebra C7. This vertebra C7 is located distal to the external occipital protuberance, which is right here, and it has a longest spinous process, so we can palpate this landmark easily. and it is easily palpated when head bent forward. Next landmark is trapezius muscle. Simply it is a diamond shaped muscle. You can see this muscle right here. Next one is scapular region. Scapular region also known as shoulder blade. Scapular region, it is a paired structure located in the upper back area. This one is the scapular region. Entire this area is scapular region. Now the paired structure located in the upper back are nothing but these two scapulas. To discuss in detail about scapula, scapula has three important landmarks. Firstly, the spine of the scapula, middle border of the scapula, and inferior angle of the scapula, and also interscapular region. Firstly, for the spine of the scapula, this one is, you see right here, the highlighted one is the spine of the scapula. This spine of scapula separates the supraspinous fossa superiorly and infraspinous process inferiorly. Simple as that by their names. You can see this one is the spine of the scapula. It separates. This one is the supraspinous fossa, and this one is the infraspinous fossa. Medial border of the scapula. This one is the medial border of the scapula. It runs parallel to the vertebral column, so it refers as vertebral border of scapula. So you can see it is running parallel to the vertebral column, so that's why it is also known as vertebral border of scapula. Next one is inferior angle of scapula. Simply it is inferior one. You can see this landmark right here. Simply it is the inferior part of the scapula. Lastly, interscapular region, simply the space between two medial borders of the scapula. We can also say the suprascapular region area, which is above the supra means superior to the scapula. Inter means the space between two medial borders of the scapula, this one, and the infrascapular area, which is inferior to the scapular area. Our next anatomical landmark on the posterior aspect is latissimus dorsi muscle. It is located inferior to the scapula, and it is the largest muscle in the backside region. It can be palpated from mid to lower back. You can see the latissimus dorsi muscle here. Next one is iliac crest. It is located towards the inferior aspect of the to the latissimus muscle. You can see in the highlighted one, that is the iliac crest. Next one is lumbar triangle. Firstly, it is anatomical space. This lumbar triangle is bounded by inferiorly by iliac crest, posteriorly by latissimus dorsi muscle, and anteriorly by external oblique muscle. You can see this lumbar triangle right here. This is the lumbar triangle. Next one is posterior superior iliac spine. Two smaller circular depressions on the ilium are called posterior superior iliac spine. These two are called back dimples or dimples of Venus. These two are the posterior superior iliac spine. To add a little on lumbar triangle, inferior, it is bounded inferior by iliac crest. You can see this one is the iliac crest. The highlighted one in blue is the iliac crest. It is bounded inferiorly by iliac crest. Posteriorly by this one is the latissimus dorsi muscle, and anteriorly by this one is the external oblique muscle. To continue, sacral triangle. It is a triangular depression between two posterior superior iliac spines. Here, this one is the sacral triangle. If this is the PSIS, there is a small triangle. like this one is the sacral triangle, which is very clear in this image. This one is the sacral triangle. In this sacral triangle, in this region, the ilium articulates with the sacrum to make sacroiliac joint. Last but not least is anal region. The components of anal region are anal canal, muscular sphincters, and anus. Anal canal, it begins as a continuation of rectum and terminates at the anus. And anus is the most distal portion of the digestive system. In the picture, this one is the anus region. Thank you.